Most hospitals are built on one simple idea, that the people wearing white coats are there to save lives. Patients never question the medication they're given. They trust the doctors, they trust the nurses, and they trust that every IV bag hanging beside a hospital bed is completely safe. But at one surgical center in Texas, investigators would eventually discover that one person had turned that trust into something deadly, and almost nobody saw it coming. In 2022, doctors at Baylor Scott & White Surgicare North Dallas began noticing something they couldn't explain. Healthy patients were suddenly suffering medical emergencies during routine procedures. Some experienced dangerously low blood pressure. Others went into cardiac arrest. At first, there didn't seem to be a clear reason. Complications can happen during surgery, but as the number of incidents continued to grow, staff members realized these cases didn't seem like ordinary medical complications. Something wasn't adding up. Then everything changed. A fellow doctor arrived at the surgical center feeling perfectly normal. She prepared for what should have been another ordinary day at work. At some point, she used an IV bag that had been stored inside the facility. Almost immediately, she became seriously ill. She was rushed to the hospital. Despite every effort to save her life, she later passed away. Her death shocked everyone who knew her. Doctors couldn't understand how someone healthy had deteriorated so quickly. An autopsy was ordered. The results were alarming. Investigators found a combination of powerful medications inside her body that should never have been there. The medications hadn't been prescribed. They hadn't been administered during treatment. Somehow, they had entered her bloodstream through the IV bag itself. That discovery completely changed the investigation. Instead of looking for a medical explanation, detectives started treating the case as a criminal investigation. Every IV bag inside the surgical center suddenly became potential evidence. Federal investigators, hospital security, and forensic specialists worked together to determine how the contamination had happened. As they examined the bags more closely, they noticed tiny puncture marks. Someone had pierced the plastic with a syringe. The original contents had been altered. Laboratory testing confirmed that several IV bags contained dangerous drugs that were never supposed to be inside them. Now investigators had an even bigger question. Who had access to those bags? Surveillance cameras soon became one of the most important pieces of evidence. Hours of security footage were carefully reviewed. According to prosecutors, one person repeatedly appeared near the storage area where the IV bags were kept. That person was anesthesiologist Raynaldo Ortiz Jr. Investigators believed he had secretly removed IV bags, injected them with powerful medications, resealed them, and returned them to storage without anyone noticing. The altered bags would later be used on completely unsuspecting patients and staff members. As the investigation expanded, authorities linked the contaminated IV bags to multiple medical emergencies that had taken place over several months. Patients who had unexpectedly gone into cardiac arrest were now being re-examined. Medical records, toxicology reports, and surveillance footage were compared. The evidence pointed to a deliberate pattern rather than a tragic accident. But prosecutors told the jury that the physical evidence, surveillance video, laboratory testing, and witness testimony all pointed in the same direction. After hearing weeks of testimony, the jury reached its decision. In 2024, Raynaldo Ortiz Jr. was found guilty on multiple federal charges, including tampering with consumer products resulting in death and serious bodily injury. When it came time for sentencing, the judge described the crimes as extraordinarily serious because they violated one of the most fundamental expectations inside any hospital, that patients should be safe. Raynaldo Ortiz Jr. was sentenced to 190 years in federal prison. For the victims, their families, and the medical staff who unknowingly worked alongside him, the sentence brought an end to a case that had shaken the healthcare community across the country. It was a reminder that sometimes the greatest danger isn't outside the hospital doors. Sometimes it's the person everyone believed they could trust.